Science have actually debunked a lot of theories. Medicine have actually brought a lot of conditions that were before unimaginably managed into light, how those things can actually be managed. Science have actually brought to light those things that we only knew in shadows. But when it comes to pain, it is one symptom or sign that science and medicine is here to give us a standard definition. Interestingly, pain is actually what the client tells you it is, where he tells you it is, and how he tells you it is. To give you the perspective, let's define pain. Pain can actually be seen as an unpleasant sensory or emotional experience that shows the presence of an actual or potential tissue damage. Haven't understood this? On this very video, we'll go at length to tell us what are the various types of pain, the causes of pain, the prevention for pain, treatment and management of pain, and I will end with telling us the reason why we should study pain. Maybe we'll also add to it a life experience. So therefore, without making further ado, let's jump into the discussion for today. We started by saying that pain is an unpleasant sensory perception or emotional perception that shows the presence of an actual or perceived tissue damage. Now, let's go to the various types of pain. Pain can actually be classified into 8 broad classes. So the first one has to do based on location. The pain can actually be internal or external. We have based on severity as the second one. So the pain can actually be mild, moderate, or severe. Based on the cause, which is the factor that caused the pain, it can actually be physical, psychological, or emotional. Based on chronicity, which is the fourth one, or based on the time of onset, it can actually be acute or it is chronic. And then the fifth one, which is based on the circumstance that caused the pain, it can actually be phantom pain, actual pain, or potential pain. Based on the tune or description or pattern of that pain, it can be classified into aching pain, throbbing pain, pricking pain, dull pain, radiating pain, burning pain, and stabbing pain. Now, the seventh one is based on duration. It can actually be either a prolonged pain, a constant pain, an intermittent pain, or occasional pain. And the last one, which is based on the source or the predisposing or precipitating factor, can be classified into thermal factors or thermal pain, and then pain resulting from chemical substances, and then pain resulting from surgeries or cultural factors. So just to give us a better understanding of the 8 classes we have actually stated, we'll pick on some of them and then we're going to talk about them. So for the first one, which is based on location, we'll have the external pain, being that pain where you can visibly see it. The client can point at it, can refer to it, and you can see how it looks like. So an instance is bruises. Is one good instance to see. Stabbing is another one. So we have based on the internal type of pain. This one is the pain where you can't visibly see it but can only be described by the client, because pain itself in its definition, we remember I say, is what a client tells you it is, how he tells you it is, where he tells you it is. So now that's where the internal type of pain comes in. So in this one, the client can tells you, I'm having chest pain, I'm having pain inside my stomach, or I'm having stomach ache, and so on. So that's a form of internal pain. Now the second class, which is based on severity, we have the mild pain. In this one, the client can go about his normal day life, can carry out his activities of daily living without obstruction. Whereas to have the moderate pain, this type of pain, the client it will interrupt with the client's activities of daily living, but he can still carry out certain activities. And the mild and moderate pain can go off on their own, except that for the moderate pain, sometimes may require a bit of drugs or medications. They will not have the severe pain. In this severe form, the client cannot go very well without breaking down, or cannot carry out his or her activities perfectly well. it will interrupt the activities of daily living. And this kind of pain, the client will manifest it both facially and in terms of the mood or the affect of the individual. You can directly know that this client is in pain. The third class, which is based on the cause, we have the physical pain. Under this physical pain, it can actually be peripheral or neurologic. Now, for the peripheral pain, they originate from structures outside the central nervous system. And the first one will be the superficial pain. In this type of pain, it actually has to do with the skin. All right. So, this type of pain, the client will tell you where the pain is. You can even see the pain for yourself. All right. Then we'll have an instance of that kind of pain, which is the pain will be pricking in nature, it will be dull in nature, it will be burning. This kind of pain are mostly coming from trauma or insult to the skin. All right. So the second type of peripheral pain is the deep somatic or visceral pain. In this one, it is actually the form of pain that affect the deep structures of the body. An instance is kidney pain, the liver pain, and then the spleen pain. And this kind of pain are actually aching in nature. The third type of peripheral pain is the referred pain. This type of pain, it happens in one point but is felt at another location. So the pain, the affectation, the cause is far from the point where the pain is felt. We refer to that type of pain as referred pain. And now it is an instance of it is where we have gallbladder pain or damage of the gallbladder, but the pain is felt at the shoulder of that very individual, within the shoulder. So that is a form of referred pain. The fourth type of peripheral pain is actually the anginal pain. The anginal pain affects the heart of the individual, but you can see that the individual would have this pain or feel the pain in his or her limbs. Do we get? So the pain is actually located at the heart. The heart. An instance is cardiac hypoxia, which is an insufficient oxygen in the blood. All right? The state where there is insufficient oxygen in the blood, hypoxia. Now, the fifth kind of pain is actually the radiating pain. Now, this is a form of peripheral pain whereby the pain starts from one point and shifts to other points. In this pain, you can feel it at your thumb, and the next day, the whole of that hand, if touched, you feel the pain. And this type of pain, it mostly comes with swelling as well as other associated symptoms. Now, example of this kind of pain can be where you have weak low. Now, the whole of that hand can get so painful. That's a form of radiating pain. All right. The last one, which is the second type of physical pain, is the neurogenic pain. In this type of pain, it is actually that pain within the central nervous system, and this type of pain is distributed around. So an instance of this is where we talk about multiple sclerosis, meningitis, cerebral malaria, and so on. Those kind of pain, it's that pain that there is a direct affectation of the nervous system. So the next one is the psychological pain. Now, in the psychological pain, we're actually referring to pain where you cannot directly point at the place that is affected. It is the pain that is actually caused by the neurological functions being affected. When we mean neurological functions, we mean, for instance, the thought process, the judgment, and so on, where the nerves, function of the nerves are being affected. That's where you feel this psychological pain. So an instance is where there's a loss of loved one, where there is the loss of employment, where there is the betrayal or denial, and so on. You can have psychological pain. And where there is excessive stress, especially the distress, this kind of pain will cause you a psychological pain. Then we have the emotional pain, which is another form of it. All right. Now, The there's just a bit difference here in the emotional and psychological pain. The emotional pain is just a subclass of the psychological pain, but just that this kind of pain can make the patient grieve and break down into things such as depression. All right. So having said that, we'll go to the next, which is the fourth uh, classes of pain. And this one is actually based on the time of onset. We have the acute pain. These are pain within a 24-hour period to even as much as 2 weeks period. All right, we classify this kind of pain as being acute. But when the pain from 6 weeks to 6 months, that time duration will classify it as a chronic pain. So it didn't just start today, it didn't just start within the past 2 weeks. So that is an instance for it. An instance of a chronic pain would be arthritis, while an instance for an acute pain could be that resulting from road traffic accident. Any pain resulting from road traffic accident is actually an instance for an acute pain. So the fifth class of pain is that based on circumstance. So could have the phantom pain. Now in this kind of pain, it is just a pain where the clients perceive the pain, but there is no direct affectation. No direct affectation. This mostly is found in clients that abuses substances. Say the client had road traffic accident in the past and then had fractured. With this fracture, a lot of surgeries were done on that client. Then along the way, while trying to handle the client got addicted to substance such as or medication such as pentazocine. These clients would use this very drug to cure the pain to the point where that particular original pain is no longer there. But the client still keeps on complaining that without using that pentazocine, he or she is feeling the same pain he had when he had that very accident. Haven't understood this, that will take us to the sixth class of pain, which is based on the tune or description or the pattern of which the pain expresses itself. It can be aching, and this type you feel it in your heart. You feel it in your heart. It can be throbbing. This type of pain comes in where you bruise your hand. All right, and then it can be pricking. This one comes in form of when sharps you prick yourself, maybe with needle or you step upon nail. It will give you this type of pain called the pricking pain. Then there is the dull pain, mostly pain such as appendix. This kind of pain can give you either the throbbing or the dull pain. All right, pain within the internal organs. Now we have the radiating pain, just as we said earlier. This kind of pain where it starts from one point but extends to another point. So an instance of it is what I mentioned earlier, the wicklow. Now we have the burning pain. This type you feel it, it's very hot. So we have the stabbing pain. An instance is that of knife. The pain will be stabbing in nature. That takes us to the seventh class of pain, which is based on the seventh classification of pain, which is based on the duration. So it can either be prolonged, where the pain is actually going and coming, but for a longer period of time. Then we'll have occasional pain. In this form of pain, the pain can go off for like 1 week to 1 month, but later you feel the pain again. Then we have constant pain. In the constant pain, it doesn't go off. It is just there. Then we have intermittent pain. This one will give you split seconds to or split minutes to hours, and then it will come back again. So that takes us to the last classification of pain, where we have that results from thermal factors. An instance is where this client is burnt by hot water. That is an instance of thermal pain. Then we have the chemical pain. In this form is where the client is exposed to a chemical substance. For instance, acid can cause chemical pain. Then we have the surgical pain, which is based on medical procedures. So we now have the last one, which is cultural pain. For instance, female genital mutilation, pain resulting from abuses, pain resulting from ostracizing the client and the client or the individual. And then pain resulting from stigmatization can be fixed under this cultural pain. That takes us to the next topic which we'll consider, and that is the causes. From all we have explained earlier, you will find out that we have already mentioned some of those causes of pain. They could come from injuries or trauma, they will come from infections or inflammation, they could come from chronic conditions such as arthritis and diabetes. In diabetes, you can have things like neuritis and so on. Those form of pain are actually manifesting as a symptom of diabetes. All right. Then we can have nerve damage or compression of the nerves. Now, in this form is where there is a damage of the nerves, or where there is fluid in a particular place where that causes swelling, hence producing much pressure on the nervous endings or the nerves endings. So this can cause pain. We have the fifth one factor that can. We have the fifth factor that can cause pain, which is the cancers and tumors. We have the sixth factor that can also cause pain, which are hormonal changes such as menstruation and then the menopause. Menstruation already females can relate that it causes a lot of pain. And then menopause also comes with its own pain, for instance, the heat flushes and so on. So we have the other factor which we'll mention as the mental sources or the mental health conditions such as depression and anxiety. They could actually be a form of factors that causes pain. So that takes us to the symptoms of pain. Now, pain will not live for itself without dropping a sign for you to know this individual is actually undergoing an unpleasant experience. So, what are those expressions that pain would show for you to diagnose the presence of pain? We have the individual will have a sharp or dull aching experience. The individual will have a burning or stabbing sensations. The individual will have a numbing. The individual will have numbness or tingling sensations at that location. The individual can have weakness or fatigue as a sign or symptom of pain. The individual can have limited mobility or flexibility of that particular part that is affected. The individual can have mood swing or mood changes such as irritability or depression. Anybody in pain, you won't expect that person to associate very well, to interact very well. It becomes irritable in nature. You get? So having said that, how do you diagnose pain? You can diagnose pain based on one, using the rating scale, which is you ask the client in a scale of 1 to 10, where 1 to 3 is a mild pain, 4 to 6 is a moderate pain, and then 7 to 10 is a severe pain. Which of them can you describe or place your pain? The next way is either the facial expression of the client or the bodily manifestation of the client, and what the client actually tells you and how it tells you it is. So you can also do imaging tests to rule out things such as internal tissue damages. You can also do laboratory tests to check the blood of the individual to know if there are things like occult blood, if there are things like pulse, which is exudate, and so on. Or you can do urinalysis to pick out other factors that are present that are causing pain, for instance, kidney pains and so on, or the presence of bacterial infections, or the presence of viral infections and other forms of infection. So you can also do pain assessment, as I've said earlier, using the scale. Now, what are the treatment options available for individuals that are facing pain? When we talk about treatment, we are aiming at curing the pain. Okay? It's a subclass for managing pain. So when we talk about treatment, we are looking at the curative aspect. Now, the first one would be physical therapy, where you implement other things like cold compress, you do things such as exercise and so on, just to take away that pain. We have the second one, which has to do with alternative therapies such as acupuncture or massages can be done on that individual. We are familiar with the aspect of massages And then we have lifestyle changes as a form of curative measure. So the individual can do exercises or stress management can be used. It can be used for that individual. So we also have interventional procedures such as injections, nerve blocks, and so on. We can also do surgeries, surgical ligations of some of those nerves. For instance, in the case of the multiple sclerosis and so on, just to take off the damaged nerves. And finally, diversional therapy can actually be used where you can tell the individual to read newspaper, to go out, to go to comfortable places, and then other physical things I did not mention, such as the cold or warm compress that is dependent on what caused the pain. So those factors can be used to treat pain. Then management of pain, which is the broad heading as I said earlier. In managing pain, there are a lot of strategies that would be put in place. In fact, it is a multidisciplinary approach that will be taken in managing pain. To manage pain, first you must identify the cause and source of the pain. Second, reassurance is very necessary. Reassure the client. Give the client supportive management. You can give support groups. They can belong to support group based on the cause of that pain. So where individuals are grouped based on similar symptoms and similar diagnosis, and they can share their experiences and how they manage their pain. And then we have the aspect of relaxation and rest. Most pain, when you sleep, it will go off. The perception of the pain will go off, or you rest, it will go off. And then we have the aspect of you offering things such as medication, which we see in the aspect of curative management. And then psychotherapy could be given where you do cognitive behavioral therapies and so on, just to talk, give the person some words of encouragement and so on. It's a form of talk therapy. Having understood this, are there complications of pain? Yes, pain, although it is a sign or could be a symptom of another condition, but itself can be a condition, and with it can cause other forms of complication. So pain can result in depression or anxiety, whether external or psychological in nature, whether phantom or based on cultural factors. And then pain can also cause sleep disturbance, resulting even as much as insomnia. Pain can also result in decreased mobility or function or flexibility of the affected area. Pain can cause social isolation, especially where it is psychological or emotional in nature. Pain can also result in the use of substances. Remember, I talked about the case of road traffic accident where the individual got addicted to the use of pentazocine. Having understood this, let's go to the next one, which is the prevention. Can pain be prevented? Yes, why not? Pain can be prevented with the implementation of the following things. First, regular exercises. With regular exercises, you make your muscles flexible and you reduce the rate of stiffness, hence making your body are able to withstand the stress that comes with other life experiences, as well as making your system able to withstand, even though you have bruises and so on, you could withstand certain degree of that pain. Now we have healthy lifestyles or healthy habits, so you don't engage yourself in unhealthy practices such as things like substance use, things like other forms of addiction generally. So you implement healthy lifestyles such as balanced diet to help you repair your tissues, make it durable and flexible and healthy so that these tissues will not be worn out by any factor at all that comes. Then stress management can be a form of healthy lifestyle habit. All right. Having said this, injury prevention such as the use of safety gears, the use of full prevention gadgets or fall prevention gadgets. An instance is the use of face masks, the use of helmets, and so on can prevent the possibility of injuries to occur, hence would prevent pain. And then we have regular health checkups. You need to do comprehensive and regular checks at least six monthly, or that is twice in a year or annually, just to know how your system and your body, especially the internal organs, are doing. And then the final way to prevent pain would be mental health support. So from time to time, try to associate with other persons, as well as services from the clergymen would go a long way to help manage pain and prevent pain. All right. So motivational speakers are also helpful in the aspect of the mental health support. So having said this, would you like more information on pain management or related topics? Please let me know in the comment box. I will end with telling us, is it necessary to talk about a topic like this? Is it necessary for healthcare professionals as well as the general public to know about pain? Yes, using a life experience. I once had toothache, and with toothache, I got to know that pain alone is enough to cause death. In fact, pain is the major reason why most clients die, beside other signs and symptoms. So pain should not be joked with. So if you have anyone facing any form of pain, understand the person that it is not his or her fault, and then see how to support that individual, see how to look for proper management for that client, and then reassure the client. And we believe by our collective effort, those in pain will actually find succor. Thank you so much. I look forward to that moment where this very channel becomes your most favorite click. Thank you, and see you on my next video.